各位傳媒朋友
Friends from the media, good morning. Thank you for attending the 11 o'clock press conference on COVID. Apart from the Chief Executive, we also have the Secretary for Food and Health, the Director for Health, as well as Director for Food and Environmental Hygiene. The CE as well as the Secretary will first speak before answering questions. Because of the epidemic, please keep your masks on and stay socially distanced. We'll first hear from the Chief Executive. Good morning, everyone. This morning, together with the Secretary for Food and Health as well as two directors, we're here to report to you about our work on testing. I'll also talk about how we have strengthened our services in public mortuaries as well as crematoriums in terms of assistance provided to grieving members. First, on testing. At every stage of our anti-epidemic efforts, we've always put our focus on early identification, early isolation, and early treatment. For early identification, we rely on testing. We thank private laboratories for their continuous support in enhancing our capabilities. Well, in terms of PCR tests, every day we have a capacity of 300,000. Well, if there are too many people in the sampling stage, there may be queues, like what we've seen before. But with the kit dispensing machine as well as an online booking system, the situation has improved. With the popular use of RAT, more and more members of the public have been using RAT kits to do tests. That's why you hear in the daily 4:30 press conference that the number of RAT positive cases reported has outnumbered that of PCR results. In terms of our work, there are two areas. First, compulsory, and second, non-compulsory. In terms of compulsory testing, there are two subcategories. First, those under the RTD, Restrictions and Testing Declaration. That is, under compulsory quarantine of persons arriving, under compulsory quarantine of certain persons, we will mount operations under the name of RTD, Restrictions and Testing Declaration. The other one is CTN, Compulsory Testing Notices. Under CTN, those involved are not required to go to a specific place to get tested. Those who are under CTNs will have to go to community testing centers, mobile testing centers, either by getting same-day tickets or obtaining prior online testing. Both of these are done under 599J. In terms of non-compulsory testing, it is done by necessary testing. It is done by voluntary testing. So members of the public can go to community testing centers if they wish so to get tested. The other one is to make use of RAT kits. I would like to tell you about our experience gathered under RTDs. The experience is of high reference value for future actions. In each RTD operations, there are 3 stages. For the building under RTD, we will release press information on 3 occasions, informing the public about the progress. The first step is for Secretary for Food and Health to issue an RTD. There will be a map specifying the actual area under the operation. The second step is that within 24 hours after we have conducted the compulsory testing in the specified area, In other words, residents living in this area would have all been tested. The third step is that several hours later, in relation to the restricted area, when law enforcement actions have already been taken. That is, if one is to leave the area, they have to show proof, say, for example, in the form of an SMS that they have been tested before they are allowed to leave. In the fifth wave, we have conducted 287 operations under the lockdown. That is about 3 to 4 times per day. All of them have been completed within 24 hours. Well, apart from on 17 occasions when it has taken more than 1 day. The longest one was 7 days. Here are my observations. In the past week, for preliminary positive cases under the compulsory testing, the number has been dropping to a single-digit figure. That is, if there are 100 people who are to be tested, previously we could easily find a dozen positive cases. Now it's only a single digit. The lowest number is the one announced this morning. That is, the one started yesterday. We have tested 549 residents. We've only identified 2 preliminary positive cases. The percentage is 0.4%. That is particularly low. The previous low figure was about 1.4%. But don't forget that in our work of RTD, that is, if the resident is within the localized area, however, but if they have been a positive case in the past 3 months, regardless of whether the case has been reported to the CHP, that person does not need to undergo sample collection. So the low percentage has to be viewed together with the number of previously infected persons. So I've asked my colleagues to obtain another figure. This figure is not 100% accurate. We rely on self-declaration by residents to our staff members under RTD that they have previously been infected. Let me give you an example. Well, a question was asked by our reporter. On the 25th and 26th of March, we have conducted an operation over 4 blocks in Kwong Fuk Estate. It is quite rare. Usually, we scatter the buildings over different areas. But on that day or on the previous day, we found that the viral load in sewage for these 4 blocks was quite high. That's why it's decided that on the 25th and 26th of March, our efforts would focus on the 4 blocks in the Kwong Fuk Estate. Altogether, there are 5,383 residents being tested. We've identified preliminary cases 263. That is about 4.9%, which is a relatively low figure. Well, from the information we have obtained, there are 1,149 residents, which is 20% of them have already been infected. So if you add the 20% with the 4.9%, that means in these 4 buildings, there are about a quarter of the residents that have been infected with the virus. This is the situation that we need to bear in mind. For future RTD operations, those who have recovered will be excluded or exempted. Another observation of mine is that, well, we emphasize on the word compulsory. Of the over 280 or so RTD operations, we found that 2,800 residents have not complied with our compulsory testing requirement. That means after we have completed our operation, when residents leave, they were unable to produce the proof that they've been tested. That figure accounts for about 3.5% of those who are supposed to be tested. Well, this is a legal requirement that carried a $10,000 fine still. There are people who have flouted the requirement. The third observation I have is that for RTDs that is compulsory, can it cover 100%? Sometimes it is difficult to do. When our staff members go to each and every unit to knock and ask residents to go down to get tested, similarly, in the previous 287 RTD operations, 16,710 units, which is about 10.5% of the units that did not answer. Is it really the case that, well, there is such a high number of people that were not in their flats during that time? We can't verify. So that is something that will inevitably happen even when it is done on a compulsory basis. The other area is in relation to CTN, compulsory testing notices. Previously, it was suspended for about a month. It was at the time when the epidemic situation was most severe, between the end of February and end of March. We have suspended the issuance of CTNs. It's been relaunched recently. So since the fifth wave, the Secretary for Food and Health have, in relation to 2,118 locations, issued CTNs. Since the relaunch, the restart of the CTNs, we see that the number of tests are quite steady, so about 80,000 a day. We do have the testing capacity to handle the demand generated by CTNs. So the most recent one, that is the 25th of March, we have identified 6.3% of the cases that are preliminary positive. So it's still an effective tool. The third tool is RAT, that is rapid antigen test. That is a very effective, popular screening tool. It is very easy to use. It can be done by members of the public, and it will only take 20 minutes for you to get to use to know the result. The kits are either distributed by us or can be easily procured in shops at an affordable price. The daily RAT kits supplied by the government, we supply about 1 to 2 million kits. First, to those who work at the front line in an environment that is of a high exposure level as well as high risk. Those who work at residential care homes as well as cleaners. Every day, we distribute about 1 to 2 million kits. And then there is the distribution under the sewage surveillance scheme distributed by the Home Affairs Department. We have altogether distributed 10 million kits. There are also kits distributed to close contacts and those who are positive. They are included in the COVID supply kit. We have already distributed about 1 million of such kits, and in each kit there are about 6 to 7 kits. So, for the COVID supply kit that I've announced a few days ago, we have earmarked about 70 million RAT kits to be distributed. I appeal to the public to make good use of RAT kits. And please report your case if it is positive, so that the CHP will get a better understanding of the COVID situation in Hong Kong, and you'll get appropriate treatment and arrangements done for you. And I thank those who have reported their positive cases. Of the close to 400,000 cases reported, with our random checks, the number of false reports is extremely low. So I can see that with the prevalent use, RAT members of the public are very honest, which is conducive to our fight against the epidemic. And in community testing centers and mobile testing centers, we have sufficient testing capacity. Last night we have announced that in the coming 2 weeks there are about 95% of appointment slots available. So please make good use of our testing capacity so that we can achieve early identification to cut the transmission chain in our community. And these are in relation to our testing. Well, over 7,000 people have died in this outbreak. To each family, I express my deepest condolences. The Hong Kong SAR government has the duty to assist grieving families to deal with funeral matters. That's why today I have Secretary for Food and Health as well as the Director for Food and Environmental Hygiene for them to talk about how they have enhanced our services in public mortuaries as well as crematoriums to meet the spike in demand. I'll defer to the Director for Health.
Department of Health. And since the outbreak of the fifth wave and the diseased patients in the public hospitals surged rapidly, especially from late February to early March, lots of patients passed away in the A&E departments. And for those who passed away in AED departments, including those dead on arrival, they usually need to be sent to the public mortuaries for the DH handling and declared to the coroner. And therefore, the public mortuaries need to deal with number of bodies has risen multifold. And we are truly saddened by this deaths, and I would like to offer our deeper condolences to their friends and families. We understand that the friends and families are facing pressure and still grieving, and they hope that they can claim the bodies of their loved ones to deal with the funeral matters. And I'd like to take this opportunity to report of the coping measures taken in the past month. And there were 3 initiatives. First, within the shortest possible time, we tried to add the capacities of the public mortuaries in order to provide enough facilities to receive these bodies for storage. Second, we hope to streamline the procedures and add more manpower to help their next of kin to claim their body expeditiously and handle funeral and cremation permits. And thirdly, and for those in need, we're offering emotional counseling. I would like to report on each initiatives. First, on boosting the mortuary capacities, the Department of Health is running 3 mortuaries in Fushan, Kwai Chung, and Victoria Public Mortuary. Altogether 506 fixed body storage space. When the 5th wave arrived, the 3 are reopening at the Kowloon Public Mortuary and added 20 mobile refrigerators by adding an extra 240 storage spaces. And another, with building more facilities, back then we managed to add to a total of 1,350 spaces. However, due to the rapid development of the epidemic and the rising number of deaths, these 1,350 spaces quickly ran out. And therefore, we implemented 3 emergency measures. And first, And thanks to the help of the private organizations and charity organizations, the Tung Group Hospital, since the 1st of March, provided 45 spaces in the Universal Funeral Parlor. And their two care attention home provided 40 storage spaces, which included Hong Kong Cancer Society and the and other organizations, and they'll be in use since 4th and the 7th of March, respectively. Another measure we took, that with the help of the Government Works Department in Shatin Fushan Mortuary, we set up a new body storage facility with 65 fridges. At this time, we can provide 2,700 additional spaces. Since we are also constructing a new Fushan mortuary, this new mortuary can provide additional 800 spaces. And with the support of the Architectural Services Department, with 500 of the spaces have been handed over to us on the 22nd of March. Through these contingency measures, our bodily handling capacities from 1,300 to 50 to altogether as 4,600 currently. And for the past week, we see a declining number of deaths in the A&E department. The pressure has decreased. We're still monitoring the usage and will boost more spaces if necessary. And second, on rationalization of procedures and adding more manpower. The next of kin, if they passed away in the A&D or before arrival, they need to go through certain procedures. These cases, the police will make an appointment with the next of kin, and then they will need to identify the body with the help of the coroner and ask for permission to exempt from autopsy. Our forensic specialist will declare to the coroner to decide whether to issue the permit for burial or cremation. And after getting the permit, they can arrange to claim their body and for burial or cremation. We need to be very careful that the whole procedures is executed immaculately, since it was involved the work of the coroner. Immediately, we deployed over 70 colleagues, including civil servants and non-civil servants, and professional staff like doctors and pharmacies, and the general grades colleagues for assistance. And we're offering body claiming service on Saturday, and for the Kowloon public mortuary, start providing this service on Saturday, so that the next of kin can meet with the forensic pathologists and to claim the bodies of their loved ones. And we also work with the police to come up with a new measure. Other than cases to need to perform autopsy, after identifying the bodies within 2 working days, they can obtain the permit for cremation. And they can start claiming their body the next day or the day after tomorrow. And for the additional body spaces in Fushan, altogether accommodating over 1,800 bodies. But for the week that just passed, and with the police arrangement, the next of kin has started claiming their bodies in the new facility. And from today onwards, there will be a dozen or so appointments will be boosted to 200 per day, so that we can arrange to clear all the cases within the shortest possible time. And for the death cases, without going through the public mortuary, the joint offices include the Immigration Department and the FHD and the Department of Health permit offices. Operating hours is now extended, which allow the public to complete the registration in funeral matters. And thirdly, As we understand the loss faced by the loved ones of any relatives that requires help, we are providing an emotional support hotline. The number is 9814-1325, and it started operating on March 22nd, and it will last till 30th of April, and start from 9 a.m. to 9 p.m. The clinical psychologists are standing by to provide support so that these aggrieved relatives can be provided appropriate support and solutions. We're also assigning more manpower to deal with public inquiries. I would like to take this opportunity to thank the different departments for displaying their professionalism in serving the public. And I managed to boost the capacity of the mortuary in such a short time. I would like to especially thank the police and the RHSD rapid support, as well as other departments, for example, the FEHD, the EMSD, the Transport Department, the Water Supplies Department, and the Auxiliary Medical Services, as well as the Hospital Authority and the China Light Power, the coverage provider, and other contractors. That everyone had given their best and worked in unison to facilitate the loved ones to handle the funeral matters, and we're able to demonstrate as a cooperation spirit. We will further enhance the procedures of handling public bodies and keeping the situation in view. If necessary, we will provide more contingency measures. Thank you. Secretary for Food and Health.
傳媒朋友大家好。
Good morning, everyone. The FEHD will give you information about arrangements relating to our bodies. We fully understand that families are grieving. We will provide the greatest assistance available to these families to handle arrangements relating to the claiming of bodies. Just now, you've heard that the Director of Health in relation to body identification and claiming. I would like to say that our department is also involved in the assistance. What we do is that we will transport bodies from the A&E department to public mortuaries. We have 10 such teams. They've been working around the clock in handling bodies transportation. From the end of February, we have greatly enhanced our capacity. We've also engaged contractors because we are fully aware of the demand. We don't want to cause any delay. So we have increased the number of our teams from 10 to 25 teams. We've also increased our manpower by 50% on top of the increase of our fleet. So I would like to thank hospitals, the police, public mortuaries, and relevant government departments in their involvement. We have completed our special operation at the end of the week, so our work has resumed normal. So in relation to handling of bodies, I'd like to talk about first cremation. There are 6 crematoriums under our department. Apart from Cheung Chau Crematorium, which has a low usage rate, we have Collinson, Cape Collinson, Wan Shek, Wahab Shek, Kwai Chung, Fushan. We have about 130 or 140 sessions available. Starting from the beginning of the 5th wave, we expected a possible increase in demand. That's why starting from February, we have gradually increased the number of available sessions. So if you go to our website to look at the available sessions, you will see that every day there are about 300 sessions available. So our crematoria works 24 hours a day. The latest session you can book is close to midnight. Because of our adjustments, from February to now, we have made available starting about 14 to 15 days, starting from the day after you've made the application. So that's in relation to our crematorium or cremation services. For Wohab Shack, we hope that at the beginning of April there will be 2 new facilities put into operation, so we will be able to increase our number of sessions. I encourage grieving families to have the bodies of their families cremated as soon as possible. Please make good use of available sessions so that they don't have to rush to get one later. As you know, that you will have to follow certain procedures for cremation. You will have to go to the immigration department to get a death certificate. Then you have to go to the Department of Health to obtain a cremation permit, and then come to our department to make an appointment of a cremation session. On the Hong Kong Island, in Wu Chung Center, and in Kowloon, Cheung Sha Wan Center, we have a one-stop service center available. We have extended the service hours of our centers. Previously, it was Monday to Friday, morning till 4:30 in the afternoon. We have now extended it to 5:30 in the afternoon. Previously, we only work half day on Saturdays. Now it's a whole day to 5:30 in the afternoon. The purpose is to facilitate the dealing with procedures by families. Our goal is to complete all the procedures within one day. Within the same office, there are 3 counters for families to complete all 3 procedures. I would like to also talk about how we can help the funeral sector as well as relevant contractors to better help families. I would like to talk about 2 things. At the beginning of the epidemic, that is back in 2020, we worked with the CHP. In relation to infection prevention measures in dealing with bodies, we have revised an update and disseminated it to relevant trades. It's been 2 years. And in the 5th wave, we saw a surge in demand. In March, the FEHD has arranged 3 online seminars to help the sector to meet the challenges. In the seminars, we recapped the guidelines promulgated in 2020. We also worked with relevant departments as well as the hospital authority to inform the sector as to how to streamline the procedure. We thank the trade for their input. We've made adjustments. In the 3rd seminar, we have asked clinical microbiologist Dr. Nong Zhenbong to talk to the trade about points to note in relation to the handling of bodies. There was also a question and answer session. The 50 attendees have spoken very actively. They've asked questions. I do believe that these seminars have greatly helped to dispel concerns and answer questions in relation to the handling of bodies. You'll find a record of these seminars on our website. You may go to our website to find the information. We're pleased to see that the Tonghua Groups of Hospital has made available their global funeral parlor in Hong Kong to be used as a designated funeral for COVID patients who have passed away. I thank the Tonghua Groups of Hospitals. They've also made available designated areas and has increased the number of halls available for funeral services providers to handle the bodies. We thank the TWGHS, and we also hope that this will set an example for others to follow suit. Well, another issue I'd like to talk about is coffins. Because of the epidemic situation in Hong Kong as well as on the mainland, there was some delay in the supply of coffins. Let me give you some example. Every day we need about 250 or 300 coffins. 95% of them come from the mainland, and the remaining 5% is coffins produced locally. They are environmentally friendly coffins, as well as those that come from other places, say Europe or UK. As soon as we understood that there were some logistical problems in the transportation and supply of mainland coffins, we have immediately liaised with mainland companies to iron out the difficulties. From the 14th of March, we have made the liaison and arranged for 3,570 coffins to be transported to Hong Kong by road and by water. So we have sufficient supply of coffin. Today we will liaise with the sector to better understand the arrangements of transportation of coffins. We'll closely monitor the situation. With improvements made in terms of water and road transport, we think that the problem has been resolved. That is in relation to the arrangements regarding bodies. I thank our frontline colleagues. They have worked tirelessly to assist families. That's all for now from me.
We now open the floor to questions, and please raise up your hand and say the media you represent and speak through the microphone we provided. And maximum 2 questions and no follow-up questions. And on my right in the front row, TV News. The chief executive mentioned that the typo Kwang Fuk estate that 4 buildings are locked for 2 days and about a quarter or so infected. Can we extrapolate that there are 1/4 of the whole population infected? Can we adopt the typo approach to manage to implement in various districts for a de facto universal testing? And for the quarantine hotels, with the relaxation of the flight bans, even though that there are more room for quarantine, and however, some complaint about the high prices. During the previous wave, the government claimed that you're offering subsidy for occupancy below 50%. However, this time we are noticing the prices have shot up. Will you discuss with the hotel operators that would the flight ban relaxed and situation improve, then there will be less reservations, and how you offer the subsidy and how you discuss it with the operators? If in the long run, if the occupancy remains low, would it be a drain of public resources? 2 questions. For the RTD operations in Kwang Fuk Estate typo, this isn't any strategy shift. it was based on the sewage surveillance results. And recently, we noticed the low percentage of positive sewage surveillance samples. On that day, we discovered that in the Kwang Fu estate, there were quite a few building blocks reporting high positives. And there were also sewage sampling of yesterday. And based on these results, that it was concentrated on Kwang Fu estate, and therefore we should concentrate our capacity to identify the infected cases. I remember there were RTD operations in 5 buildings, 4 in Kwang Fu estate and 1 in Wang Tai Sin. From now on, if the sewage surveillance showed similar results, and while our capacity allow us to conduct operations in one go, then we will do so. Why and provide you an update? Most recently, a lot of the academics been using modeling to estimate the overall infection rate of Hong Kong. And for those undergo PCR or RAT test declarations, there are currently over 1 million in total. However, by common sense, we all know it should be more than 1 million, especially at the early stages without the RAT declaration platforms. I believe that many individuals had done the RAT test and came out positive and recovered. And from the RATD findings, well, the two figures combined amounted to about 1/4, and projected onto the 7 million people, that the proportion will be 1.8 million. However, this is on the low side of the academic estimates. How do we produce a more accurate figure? This is not easy. I admit that the current infection figures should be higher than the total number reported each day. And this morning, Professor Ivan Hung, on the Saturday meeting, he told me, currently that with the mortality rate, that the denominator is based on the CHP total cases, which is about 1 million. And he said there should be more than 1 million. We should use the overall infected population, let's say 1.8 million or 2.5 million. Then the mortality rate will be more accurate. And this is something we need to do further analysis. The aim is to let the public gauge the latest situation, and so that we can adopt some means to stabilize the pandemic situation. And for the second question, and last Monday, we announced the suspension of place suspension. A lot of Hong Kong residents will be eager to come home. For the past few days, our colleagues are working very hard, working with the hotel industry to scout for more rooms for quarantine hotels. And 2 days ago, we announced that we successfully located additional 4,400 rooms. And altogether, there will be about 10,000 rooms. And 4 more hotels will be converted for designated quarantine hotels for domestic workers. That will be 1,600 rooms. This is a very high number, especially they only need to book 7 nights. So as the capacity has been doubled. Well, so far we see that as a reasonable figure. The more hotel rooms you're attracting more people to come home, then the risk will be higher. We'll be closely monitoring the situation. If there are more room to add more rooms, we will do so. And for the subsidy to the quarantine hotels, well, we rarely need to offer subsidies. If they are willing to become a designated quarantine hotel, that means they cannot receive other guests. if the occupancy rate dips below percentage, we will offer subsidy. As far as we know, well, overall, they managed to exceed that occupancy threshold. Therefore, we're not had any subsidy yet. As for the prices determined by the hotels, this is not something the government can interfere, as it is a commercial behavior. Professor Chen, anything you can add? Thank you, CE. Just now the Chief Executive explained that overall, for the quarantine hotels, on one hand, well, this is a import cases prevention strategy. But for the arrivals to Hong Kong, they need to undergo closed-loop management. Well, our requirements on the hotels, whether they are suitable to the number of hotels, this is all part of the case prevention strategy. In the past, we observed that the reservations, as you may be aware, they were sometimes quite full. Well, to be subject to different times of the year and the epidemic developments as public health strategy. But overall, they've been operating quite smoothly. Second question, second reporter. On the front row with the gray jacket. And Orange News. I have the following questions. Well, the Hong Kong case loads dipped below 10,000 over the past 2 days, and over the past weekend, we noticed that there's a huge increase on the people flow. Do you think the people are not complying with the regulations? So, and by the end of April, we cannot relax the social distancing measures. And anything you'd like to say to the Hong Kong public? The Hong Kong U Medical School's Professor Ivan Hong mentions that the calculation of the death rate is wrong. The denominator should not be 1 million, because the actual infected population should be around 4 million. While using this figure, the mortality rate should be just about 0.18%. And what's the government take on this?
In relation to your second question, I have already answered in reply to the first question. That is not a matter of whether it's an error. The number of cases, positive cases announced by the government is about 1 million. I said that a reasonable deduction is that is more than 1 million. Our experience from Kwong Fok Estate at Tai Po shows that we have identified an additional 4 to 5%. Actually, 20% of the people have already been infected. That's why we have arrived at the notion that maybe a quarter of the population has already been infected. But with the epidemic stabilizing, we have to collate all the figures we have collected so that we can arrive at an objective view of the situation. Well, I will actively look at these figures. I do think that there is some justification to adjust it. Well, as to the denominator, whether it should be 1 million, 4 million, or a quarter of population, we will look into it. Well, I thank you for your question about a surge of people circulating in the streets. Well, there are about 3 to 4 weeks to the 21st of April before there may be a full relaxation. In between, there is the Qingming Festival as well as the Easter holidays. I understand that the public suffer from anti-epidemic fatigue and they would like to go out. We fully understand that. We appeal to you all to be patient. We will do our best in the coming 3 weeks in terms of our work in testing and isolation so that we can further stabilize the situation. If we can do that, then we can in an orderly manner, relax our social distancing measures on the 21st of April. Even so, well, members of the public should refrain from going to crowded places, keep reducing the number of cross-family gatherings, especially those involving the taking off of masks and eating. We also ask members of the public to keep their masks on. We rely on self-restraint and discipline of the public. I ask you all to be patient. Hopefully, we will be able to implement the series of work I announced previously that will take place on the 21st of April. That includes schools being reopened, evening dining service may open, and certain premises may also reopen. We all need to work together. The third reporter. On the far side to the back.
A few questions from View TV News. You just mentioned the lockdown and test operations could be some kind of reference to a universal testing scheme. Are you signaling the government is preparing for universal testing again? Do you have a timetable for that? And does that mean that the government were to conduct universal testing, those who had been infected could be exempted? And you just mentioned the calculation on the mortality rate and the actual number of infection. What exactly would the government do to, adjust the statistic if you said the actual reported number may be the actual number may be higher than the reported numbers? Thank you.
Of the two questions, the first one is about the compulsory universal test. I said last Monday that this is still a very effective tool to use, especially if we would like to aim at eliminating any silent transmissions in the community, so that we could safely resume a lot of socio-economic activities, and at the same time give us the basis to negotiate or discuss with the mainland, particularly on the resumption of some quarantine-free travel, which we did achieve quite a lot of progress last quarter. That is towards the end of 2021. So whatever we do now, we also bear in mind that we have this exercise in mind. We have not given up doing a comprehensive universal test, but the timing of doing it is very, very significant because it is a mammoth exercise. We need to mobilize thousands of staff, and we need to inconvenience hundreds of thousands of residents. So we must find the best timing that will achieve the best result before we launch a comprehensive universal test. That's why during this period, the more that we could take reference from the existing work that we are doing, the better. So that's why I said that in conducting something quite similar, that is a RTD, a restriction testing declaration, in which we require by law that the residents in a restricted area have to do the compulsory test, and they could not leave their residence until the test is negative, or if it was positive, then the Center for Health Protection will arrange the necessary and suitable isolation for these infected cases. The RTD provides us a very good reference in several aspects. One is it has given us a good indication of the extent of infection in that restricted community. Whether it is a fresh infection, that is before the test, the resident did not realize that he or she has COVID-19 virus. So this is a fresh infection case. But now, because we have taken this extra step to ask, so we are also able to discover the already infected cases or the recovered COVID-19 cases. And in the current exercise, the answer to your question is already there, because When we now do a restricted testing declaration or a compulsory testing, we said categorically, if you have been infected in the last 3 months, then you don't need to come forward. So similarly, when we are going to conduct a comprehensive universal test, the same rule will apply, because this rule is based on public health. It's not based on convenience or resource considerations. So the same rule will apply for very good reason. So that's the situation. I don't have a timetable yet. It's not easy to predetermine a timetable in the same way that I don't know how quick the cases will come down. We are fortunate in the sense that we have seen less than 10,000 in the last 2 days. I hope this afternoon's number is also less than 10,000. But we need a bit more time to monitor the situation and then decide on when to do this. As far as the mortality rates, yes, we are all very saddened by over 7,000 deaths in the 5th wave of the epidemic. At the moment, the Center for Health Protection has expressed the fatality rate as a percentage of the total number of positive cases as recorded. Okay? So it's slightly over 1 million, taking into account both the PCR results and the rapid test results. But we all know, I think by now we all know, that the total number of infected cases in Hong Kong should be far more than the recorded cases. Because before we have a self-declaration system for RAT tested positive residents, there could be a lot of people who have taken the rapid test, they were tested positive, they had very mild symptoms or no symptoms, they have recovered by now. Okay, so Professor Ivan Hong suggested this morning, and he actually suggested to me when we had a meeting last Saturday, that perhaps we should move on to use the grand total number of infected cases as the denominator to calculate the fatality rate. The numerator will be the same, will be 7,000 deaths, but the denominator, whether it's 1 million, 2 million, 3 million, or 4 million, will make a lot of difference. But for the time being, we will not move to that immediate adjustment. Otherwise, it will cause confusion. We will monitor the situation, and when we feel comfortable to decide or to ascertain what exactly is the denominator, that is the total number of infected cases in Hong Kong, we may take that into account. Thank you.
好，我哋仲有2分鐘問多一位記者問題啦。
Maybe one more reporter in the middle row. Phoenix TV. Well, Shanghai is also a financial hub. By differentiating focus on the focus area for a district-based lockdown, any reference for Hong Kong, Justin, you mentioned about a certain proportion of the restricted testing area did not respond. How can you resolve this? Does that mean that for the universal testing, there was some proportion of people refused to get tested? According to the HA projection, and for using AWE to receive the elderly residents, you need additional 1,000 mainland medical staff. At this stage, would you request the central government to send more healthcare staff? For the first question, I replied many times. For the kind of strategy to fight the epidemic by various cities has to do with its characteristics. Well, of course, and they will be always of a certain reference values, whether for Shanghai, Shenzhen, or Singapore. Well, as a kind of strategy adopted in Hong Kong, we need to look at our own circumstances. Well, as a chief executive, that we're connecting the mainland and the overseas, our advantages lie as a platform or a springboard or as super connector. Thus, we need to connect to the mainland and the overseas. That would what I call a successful anti-epidemic strategy. This is not easy. However, we should strive for this result. Well, for the legally backed lockdown testing and compulsory testing, there's certain proportion of residents did not abide, especially for the RTD operations. It's hard for the compulsory testing noticed. It's hard to guess the number of non-compliant residents, as we don't know the residents affected. For the RTD, it's different. We know that the residents will need to come up for testing. When they leave the building, we found that they did not get tested nor received the result SMS. That means that they did not comply with the order. This is actually a criminal offense, and with a fixed penalty of $10,000. Therefore, I appeal to the public that they should obey the law. By only working with the government, anti-epidemic efforts and measures, then we can have a chance to suppress the pandemic and resuming enjoying the social activities and the economic activities. Well, the AHA, with the help of the mainland medical staff, the AWE community treatment facilities, we are actually opening more beds. From initially about 200 beds, for most recently I heard from HA about 350. There might be more opening today. If we need more manpower to opening up more facilities, and of course we can tell to the central authorities. The initial batch of the main authorities mainly concentrated on the AWE community treatment facility. Another one will be the North Lantau Infection Control Center. Well, the HA need to make their own assessment, not only for the manpower in these two facilities as well as the utilization of the beds. It also needs to look at the other hospitals for the capacity to deal with the COVID patients. If there are sufficient manpower, they can dispatch some to the AWE, that we don't need to request the central authorities to send more staff. If necessary, we can take it up with the central authorities anytime. And quite often, they always respond favorably to our requests. And thank you all. Let's end today's press briefing. There will be no press conference tomorrow. We'll see you the day after.